Thank you for joining me today to talk about healthy hearts and heart conditions, brought to you by Oakland Community Health Network. My name is Nicole Nichols, and I will be your presenter today. The purpose of this PowerPoint is to help individual organizations determine the level of training needed for their staff, depending on their position and job responsibilities. Also to create an upward movement in terms of skill competency for staff. To coordinate primary care needs for people who are living with intellectual or developmental disabilities or persons who are severely mentally ill. The learning objectives today are 1, to understand the heart and how to keep it healthy, to understand why individuals are at high risk of heart disease and how we can help. 2, to discuss common heart conditions and diseases, to discuss interventions used to treat heart disease, and 3, to review IPAS goals relating to the heart and review resources available. Did you know heart disease is the leading cause of death for most ethnic and racial groups in the U.S.? One person dies every 37 seconds in the U.S. from cardiovascular disease. In the U.S., someone has a heart attack every 40 seconds. A healthy heart. The heart is a muscle. It is made up of 4 chambers and 2 pumps. The heart pumps blood, which brings nutrients and oxygen to the body's organs. A typical heart rate is 60 to 100 beats per minute. Risk factors for heart disease. Controllable factors. Uncontrolled diabetes, stress, smoking, diet and exercise, and substance use. Uncontrollable factors. Age, genetics, sex, race, and ethnicity. Did you know people with behavioral health and substance use disorders died decades earlier than the general population from untreated and preventable chronic illnesses such as heart disease? They have reduced access to quality care and services. They often live in poverty and experience additional or increased risk factors for heart disease. You can help by assisting with integrated care, coordinating primary care services, connecting people to resources, providing education on the importance of prevention, and promoting health screenings. How to keep the heart healthy. Exercising. 150 minutes of moderate aerobic activity a week. You can also split up activity throughout the week, incorporate it into daily routine to make it work for you, and some activity is better than none. How to keep the heart healthy. Maintain a healthy diet. Choose healthy, unprocessed foods from all the food groups. Eat foods high in fiber and healthy fats. Reduce saturated fat, trans fat, salt, and sugar intake. How to keep the heart healthy. Tobacco. Work towards quitting. Tobacco smokers are at a greater risk for heart disease and stroke. About 50% of people with behavioral health disorders smoke, compared to 23% of the general population. You can view quit resources at the link below. How to keep the heart healthy. Substance use disorder. Heavy drinking and binge drinking causes high blood pressure. Cocaine can cause heart attacks and strokes. Prescription medication can be abused and lead to serious medical problems or death. You can view substance use resources at the link below. What is heart disease? Heart disease refers to several types of heart conditions, such as coronary artery disease, congestive heart failure. Symptoms of heart disease are a heart attack or heart failure. Heart attack happens when a part of the heart muscle doesn't get enough blood. The major symptoms of a heart attack are chest pain or discomfort and shortness of breath, feeling weak, lightheaded, or faint, pain or discomfort in the jaw, neck, back, one or both arms, or shoulders. Now let's watch a video about what happens during a heart attack.
Approximately 7 million people around the world die from heart attacks every year. And cardiovascular disease, which causes heart attacks and other problems like strokes, is the world's leading killer. So what causes a heart attack? Like all muscles, the heart needs oxygen, and during a heart attack, it can't get enough. Fatty deposits, or plaques, develop on the walls of our coronary arteries. Those are the vessels that supply oxygenated blood to the heart. These plaques grow as we age, sometimes getting chunky, hardened, or inflamed. Eventually, the plaques can turn into blockages. If one of the plaques ruptures or cracks, a blood clot will form around it in minutes, and a partially closed artery can become completely blocked. Blood flow is cut off to the cardiac muscle, and the oxygen-starved cells start to die within several minutes. This is a myocardial infarction, or heart attack. Things can rapidly deteriorate in the absence of treatment. The injured muscle may not be able to pump blood as well, and its rhythm might be thrown off. In the worst-case scenario, a heart attack can cause sudden death. And how do you know that someone is having a heart attack? The most common symptom is chest pain caused by the oxygen-deprived heart muscle. Patients describe it as crushing or vice-like. It can radiate to the left arm, jaw, back, or abdomen. But it's not always as sudden and dramatic as it is in the movies. Some people experience nausea or shortness of breath. Symptoms may be less prominent in women and the elderly. For them, weakness and tiredness may be the main signal. And surprisingly, in many people, especially those with diabetes, which affects the nerves that carry pain, a heart attack may be silent. If you think that someone might be having a heart attack, the most important thing is to respond quickly. If you have access to emergency medical services, call them. They're the fastest way to get to a hospital. Taking aspirin, which thins the blood, and nitroglycerin, which opens up the artery, can help keep the heart attack from getting worse. In the emergency room, doctors can diagnose a heart attack. They commonly use an electrocardiogram to measure the heart's electrical activity, and a blood test to assess heart muscle damage. The patient is then taken to a high-tech cardiac suite, where tests are done to locate the blockages. Cardiologists can reopen the blocked artery by inflating it with a balloon in a procedure called an angioplasty. Frequently, they also insert a metal or polymer stent that will hold the artery open. More extensive blockages might require coronary artery bypass surgery. Using a piece of vein or artery from another part of the body, heart surgeons can reroute blood flow around the blockage. These procedures reestablish circulation to the cardiac muscle, restoring heart function. Heart attack treatment is advancing, but prevention is vital. Genetics and lifestyle factors both affect your risk, and the good news is that you can change your lifestyle. Exercise, a healthy diet, and weight loss all lower the risk of heart attacks, whether you've had one before or not. Doctors recommend exercising a few times a week, doing both aerobic activity and strength training. A heart-healthy diet is low in sugar and saturated fats, which are both linked to heart disease. So what should you eat? Lots of fiber from vegetables, chicken and fish instead of red meat, whole grains, and nuts like walnuts and almonds all seem to be beneficial. A good diet and exercise plan can also keep your weight in a healthy range, which will lower your heart attack risk as well. And of course, medications can also help prevent heart attacks. Doctors often prescribe low-dose aspirin, for example, particularly for patients who've already had a heart attack and for those known to be at high risk. And drugs that help manage risk factors, like high blood pressure, cholesterol, and diabetes, will make heart attacks less likely too. Heart attacks may be common, but they don't have to be inevitable. A healthy diet, avoiding tobacco use, staying fit, and enjoying plenty of sleep and lots of laughter all go a long way in making sure your body's most important muscle keeps on beating.
Stroke. A stroke is a result of a sudden interruption in the blood supply of the brain. The acronym FAST can help recognize signs of a stroke. The F stands for face drooping, A for arm weakness, S for speech difficulty, and T for time to call emergency services. High blood pressure, also known as hypertension. High blood pressure is when blood pressure, the force of blood pushing against the wall of the blood vessel, is consistently too high. Uncontrolled high blood pressure increases the risk of serious health problems, including heart attacks and stroke. Did you know severely mentally ill individuals living in Michigan are more likely to die from high blood pressure than the general population? High blood pressure is in the top 10 causes of death for the severely mentally ill group in Michigan. High blood pressure is not in the top 10 causes of death for mild, moderate, or the general population. Here are the combined top 10 leading causes in the severely mentally ill group. 10 leading causes accounted for 36.9% of all deaths in Michigan during 2008 through 2013. Cholesterol. Cholesterol is a waxy, fat-like substance found in the body's cells. Your body needs some cholesterol, but too much cholesterol can cause plaque to build up in your arteries. HDL, or high-density lipoprotein, is known as good cholesterol. LDL, or low-density lipoprotein, is known as bad cholesterol. Please note that some antipsychotics affect cholesterol. Coronary artery disease. Coronary artery disease is the most common type of heart disease and the leading cause of death in the United States. It happens when the arteries that supply blood to the heart muscle become hardened and narrow, usually because of plaque. Symptoms can include chest pain, fatigue, and shortness of breath. Congestive heart failure. About 5.7 million Americans are living with heart failure. The heart muscle slowly weakens and loses its ability to pump blood. The heart is unable to pump enough blood to meet the body's needs. Symptoms include shortness of breath, fatigue, and weakness. Cardiomyopathy, a disease of the heart muscle that makes it harder for your heart to pump blood to the rest of your body due to an enlarged, thickened, or rigid heart muscle. Cardiomyopathy can lead to heart failure. Causes can include alcoholism, a viral infection, congenital deformities, chronic high blood pressure, COPD, and untreated thyroid disorder. Symptoms include swelling, fatigue, rapid weight gain. Peripheral artery disease, also known as PAD. The narrowing of peripheral arteries serving legs, stomach, arms, and head. Most commonly affects arteries in the legs. PAD is a risk factor for having a stroke, heart attack, and heart failure. Symptoms may include leg pain, dead tissue, and poor nail growth. Heart valve disease occurs when one or more of the heart valves doesn't work properly. The heart has 4 valves that keep blood flowing in the correct direction. In some cases, one or more of the valves does not open or close properly. This can cause blood flow through the heart to your body to be disrupted. Symptoms may include chest pain, lightheadedness, and shortness of breath. Arterial fibrillation, also known as Afib, an irregular, often rapid heart rate that commonly causes poor blood flow. The heart's upper chambers, the atria, beat out of coordination with the lower chambers, the ventricles. Symptoms may include palpitations, shortness of breath, and fatigue. Now let's watch a video about AFib.
Hello, my name is Dr. Kamal Kotak. I am a cardiac electrophysiologist. Electrophysiologists are heart doctors who treat heart rhythm problems. Our heart is a pump with its very own sophisticated electrical system. It is this electrical system that can have problems sometimes, which are called heart rhythm problems. These heart rhythm problems can cause severe symptoms and sometimes they can be life-threatening. Today I would like to talk about one such heart rhythm problem called atrial fibrillation. It's also known as AFib. It affects 3 to 5 million Americans and over 33 million people worldwide. It is an irregular rhythm that starts in the top left chamber of the heart called left atrium. It not only causes significant symptoms such as dizziness, palpitations, lack of energy, it can also weaken the heart, what we call heart failure. The biggest worry, however, in this patient with AFib is that people who have AFib are 5 times higher risk of stroke. In addition, the strokes due to AFib are more severe. AFib can cause stroke even if patients don't have symptoms. In fact, significant number of patients who have stroke and we don't know the cause, they can have AFib as underlying reason. We then use blood thinning medications in these patients with AFib to prevent stroke. Treatment for AFib itself include medications and ablation. Unfortunately, medication may not be fully effective and they may have side effects. AFib ablation is a safe, effective procedure and it's minimally invasive, which means cuts and stitches are not needed. AFib ablation is usually done using advanced 3D mapping technology by which we can precisely navigate to the areas of the heart and treat the disruptive signals. Patients' recovery is quick and they usually go home next morning. With this type of procedure, patient can live symptom-free, have better quality of life, not worry about side effects of medications, and potentially lower the risk of serious complications that can happen with AFib.
Here are some SMART goals for healthy hearts. Goal setting should be specific, measurable, attainable, relevant, and time-bound. Goal number 1, I will work at remaining healthy by scheduling and attending an annual checkup with my primary health care provider in the next 2 months. Goal number 2, in the next month, I will establish a cardiologist for my heart condition by calling my insurance company to request a list of participating cardiologists. I will select one and I will schedule an appointment. A reminder, it is important for people served to regularly see a primary care physician regarding their mental health, medication management, and physical ailments to promote healthcare integration. Here are some national resources. Here are some local resources. My Strength. My Strength offers web and mobile self-help resources, empowering people to be active participants in their journey to becoming and staying mentally and physically healthy. A reminder, don't forget to take the quiz linked to the video description to test your knowledge. Questions, you can contact us. Thank you for joining us today to learn about healthy hearts and heart conditions.